Hi everybody. So today we will be talking about the type of treatments for breast cancer, specifically the stages and how we will handle the regimens. I'm learning about it in class today, and it's sort of been kind of confusing to me, but I think I've gotten it straight. It's not going to be everything. This is sort of just like an outline, and I figured out a way to make it a little bit easier to understand, so I thought I'd share it with you all. Alright, without further ado, let's jump right into it. So, breast cancer is based on the stage. So there's technically 5 stages, but we will be talking about mostly the 4 stages, which is 1, 2, and 3, and 4. So the type of treatments depend on which stage the person is in. Okay, there are 4 different kinds. The first one is surgery, which consists of the lipectomy or the mastectomy. Mastectomy is just the surgical removal of the breast tissue from the breast. Then there's radiation, and then there's medication, and the medication includes chemotherapy and anti-hormonal. So the 4 again are surgery, radiation, chemo, and anti-hormonal. Okay, so I said depending on the stages that the person is in, we will determine what type of treatment they're going to get. So the early treatment regimen is for stage 1, 2, and 3. Stage 1 and 2, the tumor is just in the breast, and then stage 3, the tumor has spread to the auxiliary lymph node. For the early breast cancer treatment, the goal is to cure these patients. Metastasis, on the other hand, is stage 4, and the tumor has already spread to a distant site, and the goal here is to extend their survival and possibly the palliative symptoms of the patient. So we said that stage 1, 2, and 3 are the early stages, and they are curable. For these patients, we would like to implement an adjuvant therapy. So adjuvant therapy is given after surgery, A for after. And then the goal here is to eradicate and prevent recurrence of the cancer. So treatment for adjuvant is usually 4 to 6 months if you are going with chemotherapy, and 5 to 10 years for anti-hormonal therapy. The plan here is based on the tumor risk factors, and some of these factors include the stage, which we mentioned, the tumor size. If it's greater than 1 centimeter, then they have higher risk. The third risk factor is the lymph node, and we said that's in the lymph node in the auxiliary armpit, and the tumor receptor. So if the patient either have estrogen receptor, and for short we'll call this ER receptor, and the human epidermal receptor 2, and for short we'll call this HER2. So adjuvant treatment. The first type is if for the adjuvant treatment, we will always go with surgery. So remember, we want to cure the patient. So with surgery, we have a higher chance for this goal to be met. And then we base on whether or not they have the HER2 or the ER receptor. So whether or not they have ER or HER2, we will go from there to give them the treatment. So if the patient does not have either one of these 2 receptors, we would go with surgery and then chemo. So chemo, there are a lot of choices we can go with. Most likely we'll go with a cytotoxin, which consists of the taxanes, the cyclophosphamide, usually in low dose, doxorubicin, or carboplatin, for example. Now, if the patient has HER2 receptors, but they do not have the ER receptor, then again we will go with surgery and then chemo, and here we would use trastuzumab regimen. I apologize. Earlier I said the chemo for if the patient has neither the HER2 or the ER, we would go with cytotoxin. That's not true. It will be trastuzumab. Cytotoxin are just another type of chemotherapy regimen. Okay, so the next step we will go if they have ER positive. So ER is estrogen receptor positive, but they do not have HER2 receptor. Here, since they are estrogen receptor positive, we would first go with surgery, then chemo, then 5 years of hormone receptor therapy, and this is consists of tamoxifen if the patient is premenopausal, or an aromatase inhibitor if they are postmenopausal. So the fourth step we will go to is if the patient are positive for both type of receptor, both ER and HER2. Again, we would start with surgery and then chemo, rituximab regimen, and then 5 years of hormone therapy. So these are the four types of adjuvant treatments. Again, adjuvant treatment are treatment given after surgery to eradicate or prevent the cancer from coming back. Next, for advanced treatment or metastasis, we have a different regimen. If the women who are HER2 negative and ER negative, then we would go with chemo agent first. Then we would use another chemo and another chemo until it stops. So, and then if the women are HER2 positive, we would give them chemo agent with trastuzumab and pertuzumab. And if this fails, then we would go to Casicla, which is an IV regimen, or you can do trastuzumab with chemo agent number 2. And if this fails, then we can do lapatinib, which is a pill, so if the patient prefers, and then a chemo agent number 3. Okay, or we can just go to the Kadcyla, Kadcyla. The third type is if the patient is ER positive. This is the estrogen receptor. The first choice would be to go with the hormonal therapy, then chemo would be add-on if it fails. The preferred first-line hormonal agent in postmenopausal women are aromatase inhibitors, and if this fails, then we would give them the leuprolide, which is a luteinizing hormone releasing hormone, and if this fails, then we would give fulvestrant, and this is the only estrogen antagonist that is approved for breast cancer. Okay, I hope this short video helped you sort of organize your thoughts on the type of treatments for breast cancer in terms of early stage and advanced stage. And I hope that this is helpful for you, and if you like, please leave me a comment. Please, for more information, more medication and drug charts, visit Pharmacy School Geek at pharmacyschoolgeek.com. I appreciate you, and I hope you have a fabulous day.